Hello, I'm Marcus Boston, and today's video is, are all birth injuries caused by genetics? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Okay, so today we're going to talk about genetics, and we're going to talk about birth trauma and birth injuries. Now, I've been shooting a lot of videos over the last couple of days about the role that the electronic fetal heart monitor plays during labor and delivery, and what families are usually on the lookout for when their baby has suffered a brain injury at birth. And I've had some questions about this genetic issue because sometimes when we have families that contact us, they actually have started out on the genetic path, and then it's like, okay, well, we don't think that this is genetics. We think that this is actually birth trauma. This was a breakdown or a failure in the labor and delivery room on the part of the doctors and the nurses, and this is what caused the baby's injury. And so for today's video, I want to talk a little bit more about how some of these families, how they get to this conclusion, and what if you are in this situation, what should you be on the lookout for, or if you have other questions, what can you do? Now, I want to remind you that in some cases, yes, genetics will be responsible for a child's injury or for a brain injury. That can happen. But where things can get muddy a little bit is in some cases in which parents think that that is always going to be the case. In other words, a baby has suffered an injury and the doctors or the medical professionals, they are coming at the parents with a genetic argument, and in some instances even trying to blame either mom or dad as to the cause of the child's injury, when in reality, in some of these cases, it had nothing to do with that. It was a breakdown, like I said earlier, on behalf of the hospital, or the doctors or the nurses in the process. And so how some families can find this out is when they begin to go through this process, as they are asking these tough questions to the doctors and nurses, what can stick out is sometimes the answers don't meet the facts. In other words, sometimes you can have instances in which doctors and nurses are talking about genetic conditions and things of that nature, and the baby doesn't even meet some of the requirements of some of these conditions. And for some parents, this is what begins to tip them off as to, I don't necessarily know if this is really the case. Or in some other cases, which we will have parents who are trying to find answers, like I said earlier, and what they do is they will talk to a second opinion doctor regarding a diagnosis, and that second opinion doctor may confirm the diagnosis, or in some cases, that second opinion doctor will look at it and say, no, I don't agree with this, and I don't agree with it because of this, and this. And then what that does is that get the parents on another path in regards to answers for their child. So the purpose of today's video is to quickly talk with you about these issues, about the role that breakdowns in the labor and delivery room that they can have on babies when doctors and nurses, for example, fail to properly monitor the electronic fetal heart monitor, fail to note that there is fetal distress, fail to diagnose that the baby is no longer tolerating a vaginal delivery, fail to treat that fetal distress, and fail to move to an emergency C-section when warranted. If all of these things are going on and the baby's fetal reserves are exhausted, then the baby can suffer a brain injury at birth. And so for some families, like I said, that part of the story is not told. What's told is it was genetics, or what was told is, well, mom had an infection, or what was told is, well, there was some other type of developmental issue. And like I want to stress in this video today, that is not always going to be the case. If you have more questions for me, if you're watching this video today because you have more questions, on the screen you can see the phone number. Go ahead and give me a call. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys practicing law here at Boston Law Group, LLC, in the state of Maryland. And we will see you next time. Take care and enjoy the rest of your day.